Hello, my name is Gareth Morgan. I'm Professor of Medicine at the Royal Marsden Hospital and Institute of Cancer Research in London, England. I'm here at the ASH meeting, and I've just presented the results of a large study that we've carried out based on three very large clinical studies of people treated with thalidomide. The first of those studies was the Medical Research Council study in England, the HOVON study that was carried out in Holland and Germany, and the ECOG study carried out here in America. The results of this study are really interesting. We looked with a genetic tool that we've developed with the BOAC group and the IMF, looking at inherited variants in a whole number of different pathways and genes. And basically the results of this study showed that you could group the factors into three groups: one associated with inflammation, the other associated with tumor response, and the third associated with metabolism of thalidomide. And I think probably the most important of these is the association with inflammation, because deep down underlying the central feature of this is NF-kappa B, and inhibiting NF-kappa B with Velcade may prevent thrombosis. And I think that actually points to the way that aspirin works, and how we may develop treatments for this in the future that avoid the bleeding complications associated with aspirin. So I think it's actually a very exciting result. So we've used a genetic test, or a statistical test, called recursive partitioning to select from these 3,000 SNPs the three best at predicting patients who go on to develop thrombosis. And if we can build this 3-SNP test into a clinical algorithm, we should have a strong way of predicting the risk that people have of developing a thrombosis when they're exposed to thalidomide. So if we know that, then that can help us balance the risk, because with every treatment there's always a risk. So with aspirin there's a risk of bleeding, and with warfarin and low molecular weight heparin, those risks are higher. So it should allow us to select the best treatment for the appropriate patient.